Welcome to Lecture 2 of Section 2 in Medical Anatomy. In this lecture, we'll explore the muscles of the back, and for this class, we'll focus on musculoskeletal anatomy. There are three layers of back muscles. They're categorized as superficial, intermediate, and deep muscles. Superficial muscles aid in the movement of the arms. Intermediate muscles aid the muscles of respiration or breathing. And finally, deep muscles are those that move or rotate the trunk and the back. When discussing the muscles of the back, it's important to consider three main regions where the muscles of the back attach. The first is the clavicle, which serves as the only bony attachment of the back muscles to the upper limbs. Second, muscular attachment point is the scapula, also known as the shoulder blade. The humerus and the scapula are joint in function and help move the arms. Of course, the vertebrae are also major attachment points of the back muscles, as are the ribs and the sacrum. So let's shift our attention now to the superficial muscles. The first muscle, located just under the skin superiorly, is the trapezius. It originates in the skull, the ligament nuchae, which is a large ligament just posterior to the neck, and the vertebrae. The trapezius inserts into the clavicle and scapula. The function of the trapezius is to elevate and depress the shoulders, retract the scapula, and extend the head. So just inferior to the trapezius is the latissimus dorsi. The latissimus dorsi originates from two places in the body. First, it originates from the thoracic vertebrae and its surrounding connective tissue, and it also originates from the pelvis. The latissimus dorsi inserts into the humerus. Its function is to adduct, abduct, and medially rotate the arm. Just deep to the trapezius, there are a group of superficial muscles which work in a concerted fashion, so we'll talk about them individually here. There are three of them, and the first muscle of the series is the levator scapulae, which inserts into the cervical vertebrae and attaches to the scapula. Second, a rhomboid minor attaches to the lower part of the neck, specifically spinal levels C7 through T1, and it attaches to the middle of the scapula. Third, rhomboid major attaches to the thoracic spinal levels T2 through T5 and attaches to the lower aspect of the scapula. Now we'll discuss the intermediate muscles, starting with levatorus costarum. Levatorus costarum are present from spinal levels C7 through T11. They originate in the transverse process and insert in the posterior aspect of the ribs. So as you can imagine with their structure, they raise the ribs when you breathe in. So now we'll talk about two groups of serratus muscles together, since they have complementary functions. The serratus posterior superior inserts into the ribs and originates in the cervical and thoracic spinous processes. Serratus posterior superior also helps raise the ribs during inspiration. Serratus posterior inferior, by contrast, originates on the lumbar vertebrae and also inserts into the ribs. They help lower the ribs in expiration. So last but not least, we have the deep muscles. There are three groups of deep muscles: the splenius muscles, the erector spinae, and the transversospinalis muscles. These muscles help coordinate the movement of the trunk. So first, we have splenius capitis and splenius cervicus. These muscles originate in the upper thorax, in spinal levels T1 through T4, however they insert in different locations. Splenius capitis inserts into the inferior aspect of the skull, in a place called the occipital bone. Splenius cervicus inserts into the transverse process of the upper cervical vertebrae in spinal levels C2 through C3. Together, these muscles extend and rotate the neck and the head. So now we'll talk about erector spinae muscles. I like to think of these muscles as the ILS muscles, or I love spinach muscles. The I stands for iliocostalis, L stands for longissimus, and S stands for spinalis. These three muscles are unique in that they run parallel to the spine. All three muscles originate in distinct locations on the skeleton. Spinalis originates and inserts on the spinous process. Longissimus originates and inserts onto the transverse process. And iliocostalis originates on the pelvis and ribs and inserts into the transverse process or the ribs, depending on the specific location. So note how all three muscle groups of the erector spinae muscles are distinct. They start and end on different locations on the skeleton. So finally, the last deep muscles we will learn is called transversus spinalis. Transversus spinalis is especially tricky because it can be subdivided into three groups: semispinalis, multifundus, and rototors. They differ only in the number of vertebrae that they reach. All three muscles of transversus spinalis extend the trunk and assist in the rotation of the vertebrae.